Hi there, it's Dr. Ryan, and today we're going to talk about a clinical situation that I recently encountered. And this might be applicable to those individuals that are taking 5-alpha reductase inhibitors and how it may affect your serum testosterone levels. So let's go ahead and get started with it. Go ahead and share my screen here. So finasteride could be faking you out and how it might erroneously cause your testosterone levels to go up. Okay, so I recently had a patient that joined the clinic, and this individual is a 34-year-old male. He was in the financial service industry, and he had symptoms of testicular hypofunction, and he had them for about 5 years. And I used kind of a modified Adams scale to evaluate if people have testicular hypofunction or low testosterone. That's the androgen deficiency in the aging male scale. And I tend to add some other symptoms that I found to be that also correlate with individuals who have low testosterone. But this individual had symptoms of depression, poor concentration, poor erectile function, low libido, decreased muscle mass, increased adipose tissue, and just a difficulty in getting results in the gym that he used to be able to get when he was younger. And then a very disturbed sleep where he was only sleeping 5-6 hours and he was waking up consistently throughout the night. His past medical history and past surgical history was essentially unremarkable, except for male pattern baldness, in which he was taking finasteride and he was doing a dose of 1 milligram daily, in addition to minoxidil, which he was taking that was over the counter. The finasteride, of course, was prescribed to him by his primary care provider. On physical exam, it was normal, and his vital signs are stable, so otherwise unremarkable as well. Now, I get a very large panel of many different labs, but again, we're really just going to talk about testosterone here. And so when we tested his testosterone, we noticed his total testosterone was actually pretty good at 853 nanograms per deciliter. And his free testosterone, that is level testosterone that's unbound, not bound to sex hormone binding globulin or albumin, was 29.9, which is actually a little bit higher than the reference interval. I'm actually okay with individuals staying anywhere between 20 to 30 picograms per milliliter. It really depends on how they feel and whether or not it affects their hemoglobin, hematocrit, or their lipid panel, or their estrogen levels. And his estradiol levels were 44.2, just slightly above the reference interval. And again, not really something for me to worry about. Now, when we had a discussion about this, I had told him that his levels are pretty good. I had mentioned that sometimes finasteride can cause elevation of testosterone, free testosterone, and that should he want to join the clinic, it's probably a good idea for him to come off the 5-alpha reductase inhibitor for some time and then reevaluate. And I also noticed that his vitamin D levels were low. He had low B12 levels. And there are other supplements that may help with natural production of testosterone. So I suggested that, maybe he try doing zinc along with ashwagandha. And he also got on a multivitamin that I suggested as well. And he was pretty happy with that. And he said he'd reach out to me if he had any other issues. And I didn't really expect him to come back. But he actually did. And so he had done all these interventions, and he had noticed that he only gotten minimal improvement in terms of his symptoms. He had taken the vitamin supplements. In addition, I also recommended some dietary changes too, like avoiding gluten, dairy, and utilizing a healthy, high protein, low fat, and moderate carbohydrate diet, along with resistance training. And he got some benefit, but he's still feeling pretty bad and still had many of those same symptoms that we mentioned beforehand. And so I was like, okay. And he had also stopped the finasteride. He had done it for about 8 weeks. He had been off it for about 8 weeks. And so we retested labs again, and we saw that his testosterone levels were much lower. So his total testosterone level was 216 nanograms per deciliter. Now remember, prior, it was 853. And his free testosterone levels were 6.1 picograms per milliliter. Prior to this, it was 29.9. And his estradiol had also reduced as well. And that's going to be a given because less testosterone is available, of course, to interact with the aromatase enzyme and convert to estradiol. And so just a little bit of a review about 5-alpha reductase inhibitors. So basically, their main mechanism of action is they block 5-alpha reductase. And 5-alpha reductase is an enzyme that's found in the cells of many different organs, systems throughout the body. And what it does is it converts testosterone to 5-alpha dihydrotestosterone, which we just commonly call DHT. And DHT seems to be a putative reason why people tend to have baldness on their, males tend to have baldness on their scalp. Typically, testosterone will cause a progression of vellus hair to terminal hair on other parts of the body. But unfortunately, it seems in certain individuals, it causes the reversal. It causes a progression of terminal hair to vellus hair backwards, right? And vellus hair is kind of like the fine hair that you see all over your body that you'll see in prepubescent children. And then after they go through puberty, it becomes darker and coarser. That would be the terminal hair, right? And so, again, DHT for some individuals seems to cause a reversal of changing terminal hair to vellus hair. And so that's why it's utilized for individuals to prevent further balding. And it has been recognized in the literature that it can increase your testosterone levels. And it kind of makes sense, right? Because if you go back to this pathway, if you block this enzyme, well, less is being converted to DHT, which means there's going to be more testosterone circulating around, right? And as I had mentioned, this has been demonstrated in the literature. Here's a article, as many of them. It was a randomized, double-blinded, placebo-controlled trial in 99 healthy men. This was an article published in the Journal of Clinical Endocrinology in 2007. The effect of 5-alpha reductase inhibition with dutasteride and finasteride on semen parameters, semen hormones in healthy men. And as I mentioned, it involved 99 healthy men, approximately half of which were on finasteride and half of which were on dutasteride, and a third of which were on finasteride, and about a third were on finasteride, and a third on placebo. And they were monitored for about a year. And what they found was that dutasteride and finasteride, the individuals that were on those, they had significantly suppressed serum DHT, which is to be expected when compared to the placebo, and increased serum testosterone. In addition, they found that total sperm count was significantly reduced at 26 weeks for the dutasteride and the finasteride group. And then at 52 weeks, semen volume was decreased significantly, as well as sperm concentration. And they also know that there was a significant reduction of 6 to 12% in sperm motility with both dutasteride as well as the finasteride group at follow-up, at the 1-year follow-up. And so, it has been noted that testosterone levels, serum testosterone levels, will increase when you get on these medications. But also, if you are thinking about having children, you should realize that being on these medications can reduce your fertility, and it's been demonstrated in literature. And I'm certain that your PCP probably told you about this, but it's just more of a reminder about that. And this article I discussed in a prior YouTube video talking about some of the health risks associated with dutasteride and finasteride that not a lot of people seem to recognize. And I put a link to the video in the description below. Dr. Trace, in this great article, Health Risks Associated with Long-Term Finasteride and Dutasteride, it's time to sound the alarm. He talked about how there are 5-alpha reductase enzymes are found throughout the body, and just indiscriminate inhibition of them is likely going to be, in his mind, linked to many health issues. So we know that they are found in the meibomian glands in the eyes, which are important in production of tear film in the liver. Um, they may be associated, and they're found in the pancreas as well. And then, of course, the other thing to note is that DHT has a much higher affinity for the androgen receptor than testosterone. So when you block conversion of testosterone to DHT, you may get this, what he likes to call a novel form of hypogonadism, where your testosterone levels are normal, but you still have symptoms of someone who has hypogonadism, depression, decreased muscle mass, increased adipose tissue, as well as decreased libido, erectile dysfunction, etc. And he had a great diagram in the paper which kind of illustrated this. And this kind of shows how testosterone circulates in the bloodstream. And I kind of talked about this when I was talking about free testosterone. So that level is really the amount of testosterone that's not bound to albumin or sex hormone binding globulin, right? That's the amount of free testosterone. That's what's available to act at the androgen receptor within the cell. And so within the cell, 5-alpha reductase enzymes convert testosterone to DHT, right? And of course, finasteride and dutasteride act to block this enzyme. Of note, finasteride blocks about 70% of the 5-alpha reductase enzymes in the body, whereas dutasteride is a lot stronger. I think finasteride primarily blocks or it inhibits 5-alpha reductase type 2. There are actually 3 types of 5-alpha reductase enzymes. It seems to block type 3 and type 2 pretty well, but not so much type 1, whereas dutasteride blocks all 3 pretty significantly. And so you get much more inhibition. And you can kind of see that both of these bind the androgen receptor, but the key thing to remember is 5-alpha dihydrotestosterone binds it much more readily. And his thought process is that because it binds 10 times as higher, there are certain cells which may not, or organs which may not have the best blood flow in the body, where DHT may be much more important because of its high binding. So I included all the article links in the description below. So, and I encourage you guys to take a look at them. I have the PubMed links there as well. So, do your research as well. But just something to consider if you're on these medications and you are feeling some of these symptoms, before you get evaluated by your PCP or you go to a clinic that is geared towards hormone optimization, it may be a good idea to come off your 5-alpha reductase inhibitors for a period of time so you can get an accurate measure of where your serum testosterone really is. Okay, well, hopefully this has been helpful, and I will see you guys in the next video.